Okay, so we're going to have a bit of a stab at grouping some of the questions. And I know that the questions are going to be taken also and answered later at the conference. So I'm going to do a couple. There was a lot of questions about what is DFID doing in terms of situating CMAM within the development context, what's DFID doing about raising the profile of nutrition in terms of policy work, what's DFID doing about other donors following suit and funding CMAM more or doing more work on nutrition. So I'll try, it's a very big question, I'll try and tackle that. We kind of think DFID's doing a lot better on nutrition over the last 5 years, 4 or 5 years, in terms of launching a nutrition strategy and making significant commitments to increase our nutrition funding, triple our nutrition funding by 2020. And we did co-host the G8 Summit on Nutrition for Growth this June. So we hope that that kind of answers the question about what DFID is doing around nutrition and policy. There's been a whole series of donor network meetings. There's one next week in DFID. There was a meeting at UNGA that DFID and our minister spoke at with other donors in terms of coordination across donors. There's a donor network group as part of SUN, and we see CMAM as integral to SUN and the Scale-up and country plans, national nutrition plans. So we see CMAM as integral to the whole rising agenda of nutrition with other donors and globally. And I think it would be also good to talk to you, some of you later today, about how the sort of CMAM world sees their role in working across to the overarching nutrition world, and the WHO global targets around stunting and about the costed plans, the national nutrition costed plans that SUN has been working up with countries. Also, just to highlight that DFID has made a commitment to increase their nutrition spends on specific interventions by 620 million by 2020, and also a much bigger commitment to increasing our spend on nutrition sensitive, which is adding goals into our livelihoods, our education, our sanitation programs by 8% by 2020. So I'm just quickly looking down the other questions. There was also a question about what plans DFID has around tackling malnutrition in India, in South Asia, influencing governments in South Asia around negativity towards CMAM. As I'm in the presentation, I touched on our work in India, where we've increased our nutrition spend in 3 states, 3 of the highest burden states in India, so Madhya Pradesh, Bihar and Odisha, where we were working with health departments. We're now working with the Nodal Nutrition Ministry and also with the ministry that handles sanitation, working to one common goal of improving nutrition in under 5s and also other goals, reducing infant mortality and maternal mortality. In terms of I think some of the questions are getting at the sort of politics around RUTF in South Asia about negativity towards CMAM. We're working in Bangladesh and India on plans around local production and public sector products, which has been one of the critical barriers to having CMAM programs in South Asia. I think that our approach is a careful but ambitious one in terms of working very closely with stakeholders who have both been very resistant to CMAM or have been negative about having any kind of RUTF product. And so we want to be careful about our approach, but do some strategic funding, but also work to learn a lot about how to broker relationships and how to work with what is a very political environment in which we need to be cautious. So, I mean, that's a kind of overarching response in terms of that.
I know I'm sure we're probably running out of our time, but just one final, there was a series of questions about linking humanitarian and development funding and the barriers to doing that. I think within DFID, at the moment, what we're seeing is that there aren't really any barriers, actually, really, in terms of the funding. The vast majority of our humanitarian spend in more protracted crisis is now moving on to multi-year funding, so 3-5 year funding in some cases. It's a little bit more challenging in some of the rapid onset situations to think in that way, but certainly in vast majority we're moving in that direction. And that's also going alongside a lot more investment in disaster resilience. So again, looking at embedding concepts of understanding risk, doing multi-hazard risk assessments, doing preparedness planning, and actually thinking about how to reduce risk through development spend. So that's the kind of direction in which we're going in. For other donors, I think we do have to face some facts that actually it's around legislation and kind of legal setups of how other donors can, whether or not they can do that longer term funding. But I think there's some interesting things to think about in terms of how you bring together the kind of development donor art streams with maybe how the humanitarian donors can come in to help support scale up, for example, if there is a crisis. So that's it from us.
Thank you. I'm going to pass on to Ian.
Thanks. We're also feeling very popular, although we didn't have quite as many questions as David. Probably because we're not a donor. No, I'm joking. Okay. There are two people, I think, wanted to pick up on the final point Jeremy made about wouldn't it be great if the donors could start learning more coherently from one another about their lesson learning, their experiences with changing the way in which financing is done. It's so interesting to hear Abby just say, actually, for DFID, it isn't a problem. I really think DFID is probably, without wanting to make you feel too big-headed here, slightly ahead of the pack with respect to other donors. And somebody quite rightly asked the question, but isn't that the job of the Sun lead group, the donor lead group? Such an interesting point. Since we wrote the review, actually, the lead group has become a much more real body, doing real work. Now, I'm not involved in the donor lead group, obviously, but I wonder whether from this 2 days we need to consider, have we got a job to do in making sure that lead group, whoever sits on that lead group from the different donor representatives, really fully understands the constraints around financing for CMAM, some of the stuff we mentioned earlier, the stop-start, the fact that certain elements don't get funded, and what that means on the ground, the reality of that. I mean, if we're saying that CMAM is definitely getting equal billing in those donor lead group discussions as stunting, I think that's fantastic if that is genuinely the case, Anne. I have question marks in my mind about that, but let's hope that is the case. Then are we sure they fully appreciate what we're experiencing or the lessons we're taking from current scaling up and the financing constraints? And if not, can we help through different people within this room to get an advocacy position into those lead group discussions as we move forward?
Carmel, we just got a point of clarification.
Sorry, just to hijack. I just wanted to clarify one point about the Sun movement, because I think it's a really important one, because it really gets to the crux of a lot of the questions that we got asked as DFID, and also you got asked. The Sun lead group is not the Sun donor lead group, and that's really critical.
Okay.
It's a lead group that's made up of government representatives from low and middle income countries and some donors and UN heads of agencies. And actually one of the most important changes I think we need to see is that we need to get the community that's involved in implementing CMAM and kind of the emergency nutrition network and that broader community involved in the Sun movement much more closely. Yeah. Because as long as it's seen as a donor movement, and it's really not when you actually talk to the individuals involved, we're really not going to get that integration that we all kind of agree is important.
Who's been to a Sun?
Yes.
Yeah, who's part of the CSO network?
Okay, can we move on?
But
So
sorry,
Carmel,
can I
back to you.
just come back just quick? But there is a donor forum within the Sun movement. I think that's perhaps.
But there's also a civil
yes,
society from it. It'd be
there
interesting
is.
to know who's been to those meetings and lobbied for CMAM. Anybody been to a Sun civil society meeting? Hands up.
Not personally.
And anybody talked about CMAM in the civil society meetings? And okay.
Okay, so can somebody capture for us an issue about who's attending those different subgroups and meetings and who's advocating for the issues that are raising? I'm looking to my team to say, can someone catch that? Thank you. Thank you, Carmel. Jeremy, do you have some...
Yeah, a couple of questions
Thanks.
to address. One is, there was a group of questions about what we can learn from pooled and swap type funding from other sectors, and how we can capture that. And I would suggest there is an enormous amount to learn. A review would be very beneficial for the nutrition sector. There's learning around how to do various types of audit on government financing. If you put money through governments, there's stuff to learn around shadow budgeting. And I suspect there is also an issue around policy convergence when governments' policies don't converge with donors, and whether we need to find a way to distinguish between convergence around nutrition policies and convergence around wider policies, which may be more problematic. So that's one set of questions. There was also a question, a very blunt question, which read something like, how will UN agencies feasibly join up or give up their mandate? And this obviously relates to the way acute malnutrition is divided between the three agencies currently. I would suggest that the question really is, or one that certainly exercised Carmel and me, was how was the mandate around acute malnutrition derived in the first place? And who has the overview of how implementation of those mandates is working out? Because if there was an overview, clearly it would be seen that it wasn't being very effectively implemented. So there is an accountability issue there, I feel. Yeah, I think that's it.
Thank you.
I'm just going to answer one question that I feel qualified to answer, which is around cost. This has to do with the CAS presentation. How much did this cost? And I can answer a rough figure of how much CAS itself cost. USAID put in roughly 1.5 million over 7 years, and Concern also topped that up with co-funding. So I think it was around 2 million over the 7 years, or 200,000 per year, just for the CAS unit. And obviously there were contributions by Ministry of Health in terms of all the staff time, and then other donors funded the RUTF and other costs. And over to
Thank you so much. There were so many interesting questions. Unfortunately, time is not on our side to respond to all of them. There was an issue on how Malawi overcame or is overcoming CMAM is an NGO. Yeah, I think when we started the CMAM program, because it was being spearheaded by Valid and Concern Worldwide, at first it was regarded as NGO project. And usually we had little commitment from government staff. So what we did was to reverse the idea of leading the role. The government now came in to lead from the district level, central level, and even at community level. So everything that was being done, people saw it as Minister of Health intervention. And that's what we promoted. We had a learning forum that focused on that as well. And that changed the mindset of everybody. Even the CAS project, the staff were in the Ministry of Health, even though that the funding was coming from Concern Worldwide, but the staff were in the Ministry of Health offices, and they were being regarded as Ministry of Health. So that removed the concept of CMAM being an NGO intervention. There is a question on how now CMAM is being managed within MOH. Nutrition in the ministry is under a clinical directorate. So there is a nutrition section within the ministry. And from the ministry, we go now to the zones and then to the districts. So at each level, there is a nutrition focal person or nutrition section. Within the ministry, there is this nutrition section which manages CMAM, coordination and policy direction. And at zone level, they're involved very much on the monitoring, and at district level is to do with the implementation. And there is a continuation on how it is linked to SAN. The national level focal person is a member of the National SAN Task Force. And even the training manual, the SAN training manual that we produced, one of the modules within that is the CMAM. So there is that linkage within Malawi. And the last one, which is also interesting, was what was the role of UNICEF throughout the project. I think we had a number of partners, including WHO, WFP, and other bilateral donors. All these are part of what is known as the CMAM stakeholders committee. We have that committee, and it meets quarterly. The CMAM stakeholders committee, they meet quarterly, and they strategize on various implementation of the project. And they were like also guiding committee to CAS. So UNICEF has been there. It has been providing funding to some other activities of CMAM, and even also some other donors funding CAS through UNICEF. So UNICEF and other donors have been instrumental in assisting CAS to meet its objectives. Thank you so much.